A death with dignity bill is working its way through the Wisconsin legislature. Supporters say it would give terminally ill patients more autonomy on how they choose to use health services in their last days.
Our political reporter Darielle Fair spoke to some of the bill's authors and advocacy groups working to pass these laws in states across the country. Darielle.
Democratic lawmakers have introduced a bill in the state legislature that would allow Wisconsin residents with terminal illnesses to voluntarily request medication for the purposes of ending their life. The legislation requires that the patient to be of sound mind, at least 18 years of age, with a diagnosis confirming the patient has less than 6 months to live. Patients could request a prescription medication that must be administered through a licensed attending physician. The bill defines a terminal disease as an incurable or irreversible disease.
Other states, I have a list of California, Colorado, Hawaii, Maine, New Jersey, New Mexico, Montana, Vermont, Washington, and Washington, D.C. have all legalized death with dignity. It can work well in the state of Wisconsin, too, and give people the relief that they need and that they deserve and want.
I don't know if you've been around someone who has been in the process of dying, but it is oftentimes excruciating. And to know that that is ultimately on the horizon for someone and they are of sound mind and body.
I spoke with Jeff Sugarman, national political strategist for the Deaf with Dignity Center. He says the organization works to amplify the voices of terminally ill people because they believe this is a right these patients should have.
I think that dying people want this as an option at the end of their life, and it brings them great peace of mind. It really allows them to live the last days of their lives instead of worrying about what might happen to them, what kind of suffering they're facing at that particular point.
Sugarman says along with Wisconsin, their organization anticipates Michigan, Massachusetts, and New York will introduce similar bills sometime during the legislative session. Senator Hasselbein says the co-sponsorship period to support the bill is still open. In an effort to gain more support from lawmakers, she's hoping the bill will make it to the Assembly and Senate floors this time around.